Solution Summit. This is long-term care. It's supposed to be about long-term care, but the state of Washington's newest entitlement is already looking more like a long-term mess. It's scheduled to start this week, but may already be delayed. Our healthcare rights director, our Center for Healthcare and our Center for Worker Rights Director, Elizabeth Hovde, who manages both centers, is here to explain more about that. Elizabeth, welcome. I think you're still muted, Elizabeth, here. There we go.
Thanks. Hi, I'm Elizabeth Hubby, and I'm glad to be here talking to you about my research into the long-term care mess in Washington State. I have two guests joining this discussion with me today, I hope. Representative Peter Abarno, who represents District 20, the Centralia area, and Brian Ricker, the Government Affairs Manager with Schweitzer Engineering Laboratories. But first, I'll lay out some background. Following this issue has meant daily Google searches, scanning the pre-filed bills listing, continual Twitter checks as the situation keeps changing and not changing. Since the legislature isn't in session yet, it hasn't been able to change the features or timeline of the long-term care law and its accompanying payroll tax. That's despite the governor and lawmakers' vows to delay or fix this bad law. I use air quotes because fixing this law isn't possible. It isn't just flawed or slightly broken. It's misguided, it's misleading, and it's inappropriate. Just this morning, I see House Bill 1732, which was filed January 3rd and would delay the program on payroll tax that begins this month, already has a public hearing in the House Committees on Appropriations at 3:30 on January 11, and then an executive hearing on the 13th. It's interesting that several lawmakers and the governor have decided to come rescue us from a law that they were proud of and bragged about. And remember, the governor signed this bill into law in 2019, and lawmakers again stood by it while it was debated in the last legislative session. Now that there's been widespread outcry about the law from impacted workers, these lawmakers agree with us that it is not fit for Washingtonians' consumption. What will the law do? For those of you not yet familiar, it imposes a mandatory payroll tax on W-2 workers at a rate of 58 cents per $100 of employee wages and compensation with no income cap. That payroll tax begins this month and will continue for all of a person's working years. An individual with a $50,000 annual income will be assessed $290 a year. A person making $100,000 will owe $500 a year, and so on. This law takes away workers' spending and savings options for that money, and it lowers family budgets at a horrible time. Worse, this law is not patient-centered, and it creates a safety net for those in need and those not in need. That's not the role of a safety net. Going into the insurance business and doing it poorly is also not appropriate for state government. One day after 2025, if you're deemed an eligible contributor to this fund, and if you end up needing long-term care services, you're promised a benefit of $36,500 to be used on long-term care needs, no matter how much you put into the long-term care fund. Becoming eligible is tricky. You have to be vested for 10 years with no more than a 5-year break, which leaves many near retirees out of luck despite paying in during some of their highest wage earning years. You also have to need help with 3 or more activities of daily life to receive the program benefit. That is a harder standard than is required by insurance that was available in the private market before the industry killing legislation. One of my least favorite eligibility provisions in the law is the one that says you need to live in the state to receive the promised benefit. That means even if you pay in for 40 years and then go move to grandkids in Oregon or to the sun in Arizona, there's no benefit for you. It also means people who work in Washington but live elsewhere will pay in for a benefit they'll never receive. Think of temporary and out-of-state workers in regard to this eligibility provision. even if you attain eligibility for the program, those who have gone through long-term care funding with a loved one know that $36,500 is an insufficient amount for most forms of care that are needed and for as long as people need them. That's not at all what the state's marketing for this long-term program, which has been named the Washington Cares Fund, says. It's irresponsible and disappointing that the state is painting such a one-sided picture and creating false security. Take a look at the Washington Care Fund's website. Can I screen share, Dave?
You should be able to.
All right. Can you see it without looking at me?
We see it.
Okay. First, it talks about why the fund is needed. It says that it addresses the need. 7 in 10 Washingtonians over the age of 65 will need long-term services and supports within their lifetimes. That's true, according to research. There's good intentions here to make sure people are thinking about this, know about it, have means to cover it. It says it minimizes the family burden. Family caregivers who leave the workforce to care for a loved one lose their income and health and retirement benefits. While that's unfortunate, I would say that we don't need another jobs program in the state. This is part of life and something we need to be preparing for. It allows you to keep your savings. This one's tough. To pay for long-term care, many people must spend down their savings to qualify for financial support. This one always perplexes me because I think that's what savings are for, right? They're for us to use for our needs, rather than become dependents of the state. Lastly, and this has been a big one and a point of annoyance for me, it says it matters because it gives you peace of mind. By contributing a small amount from each paycheck while we're working, we can all pay for long-term care when we need it. A small amount per paycheck is relative given how much you need your budget, and saying that we're all going to be able to pay for long-term care with this $36,500 is not appropriate. All right. Screen's off. It's simply not true that there's peace of mind in this. The benefit will be helpful to those who qualify for it and will offer pay for family caregivers, but is insufficient and shouldn't give anyone peace of mind that they'll be off the hook for long-term care costs. Let me see. Another hard part is lawmakers supporting this law have erroneously pitted a state program against private long-term care insurance. Those are not the only choices for funding long-term care. Some people use real estate or other investments, and if they don't need long-term care, the savings or assets can go in other directions. It's simply not appropriate for the government to tell us how to save and how our savings will be spent. What this fund does do is help lawmakers deal with the Medicaid budget, which is a problem. It's steadily growing due to the long-term care funding needs of its applicants. Instead of making sure Medicaid can't be used for long-term care if a person has assets and savings able to use, getting rid of insurance regulations that increase prices, or starting a responsible discussion with taxpayers, lawmakers decided to tax all workers to pay for other workers and an inability to fund long-term care when there's already a safety net available for that. The state should have safety nets. Washingtonians and Americans are generous, compassionate people, but asking a low-income worker to give up a portion of her household budget today for something she may never need, or to fund a wealthier individual's long-term care services, is not compassionate or caring. This law should be repealed. The unfair eligibility provisions and insufficient benefit in the law have caused a lot of outrage, and they've spawned the delay talk from the governor. the House bill that I mentioned earlier that has hearings. There was that. There was an initiative attempt. There's a lawsuit against the Long-Term Care Act. And there's a cease and desist letter from Idaho's Attorney General. I think the class action lawsuit, the initiative attempt, and the letter from Idaho are big reasons why we're seeing bipartisan lawmaker hesitation and the tool bags coming out now. All right, so let's get to my guests who have some direct involvement with these ongoings, and feel free to direct questions to any of us after they speak. We'll address those again at the end of the session. First up is Brian Ricker. He is the Regional Government Affairs Manager for Schweitzer Engineering Laboratories located in Pullman. When I first heard about this long-term care mess headed our way, I urged employers to let their employees know about the law as soon as possible. Brian's company not only did the responsible thing and made workers aware of the tax on the way, while there was still a chance for some of them to opt out by buying a long-term care insurance plan of their own, they went to bat for 800 of their workers who live in Idaho and who would be forced to pay into this fund but never eligible for the benefit based on their residency. Schweitzer took it upon itself to communicate with the Idaho lawmakers, letting them know about this law, and they asked for help. So Brian, thanks for being here. Can you tell us more about your experience with this badly baked law from an employer's perspective, and tell us what actions you took?
Yeah, thanks for having me. We're a border community, so we knew immediately we were going to see an impact for our Idaho residents that worked in our Pullman campus. And so as we started learning more about it and the impacts, Dr. Schweitzer immediately went into action, asking us to reach out to legislators and to other businesses to make sure that they were aware of what was happening and that this bill was coming down, because we knew this wasn't just impacting bigger employers like us. This was going to impact every single person in Washington. And a lot of them didn't know. I mean, the one thing that we saw with the pandemic is that people were, while the virtual session allowed people to think they were more accessible, people weren't really as informed and weren't really aware of what was going on. And so we started researching and during the session and after the session, reaching out to our legislators. Dr. Schweitzer sent 2 letters to the governor and to leadership on both sides of the aisle, asking them to delay and stop this bill because of the impacts that it would have. And then we did internal outreach, providing over 18 sessions, I guess, about long-term care and what the impacts were and what our employee owners' options were. We were trying to find a plan, just like everyone else was, to help their employee owners or their employees be able to have options to opt out, because this is something a lot of them didn't want and didn't need. This isn't something that was on their radar. And that was the reaction we saw. We received initially over 400 emails from our employees saying, hey, this is not something I want to do. Can I get out? And we continue to receive a heavy amount of input saying this is not something they don't want. So one of the other steps that we took was reaching out to Governor Little and saying, hey, just heads up, Washington State just passed this and it's going to impact our Idaho employees because they're going to have to pay this tax, but they'll never receive a benefit. And then we reached out to the Attorney General's office as well, and Attorney General Wasden, and they were responsive and said, hey, yeah, we'll start looking into this. They hadn't heard of it. And eventually we saw on November 8th that Attorney General Wasden sent a cease and desist to Attorney General Ferguson saying, hey, this is unconstitutional. And it listed out several reasons why it was needed to be stopped. And so we took the action, just trying to be proactive. One of the things I think we're most proud of is, and I'm grateful for, is we reached out to several chambers across the state, and employers, and I'm talking from the Tri-Cities area, Moses Lake, Spokane Valley, to Seattle, Renton, and just saying, hey, are you guys aware of this bad law? Please let your members know about it. Here's the information we know about it. We're happy to share with you. We provided several sessions where we talked to employers and chambers saying, hey, here's what we know. And by the way, you need to write Governor Inslee and the lawmakers and let them know that this is a bad law and you don't support it. And so we taught people how to re-engage with their legislators. And we kind of created this network of trying to urge people to really get involved and engaged. And then, of course, Dr. Schweitzer supported the initiative process as well. And I think all of these things, like you said, really helped kind of make the governor and other supporters of this law realize they needed to do something.
Brian, I'm curious, did the state give you notice of this law or have a big communication outreach effort letting employers know that this law was going to be coming down and that your payroll was going to have to figure that out and employees were going to have decreased checks? What was the information campaign you received?
The information campaign we got was, through the Washington Policy Center, from AWB, from the legislators that were communicating with us. And we're lucky to have great legislators in District 9 that communicate with us. And then also our insurance broker saying, hey guys, this is coming down and we've got to figure out a solution for you, because the state only needed to provide 30-day notice before the November 1st deadline. And by that time, it was way too late for most people to even purchase a long-term care plan to opt out. So we didn't really receive anything from the state.
I was going to say that was a super frustrating thing about this is you're watching the law get tweaked in the last legislative session. There was that provision that they didn't have to have an outreach effort until a month before this opportunity to disengage from the fund had passed. So you knew that wasn't going to work.
Yeah.
And now they're full, it's always interesting to me that we have a lot of communication about whether we need masks or not. There's an ability for the state to really communicate with us what we need to know and get the media engaged. And we're seeing nothing. It was something.
Yeah.
Anything else, Brian, that I haven't touched on that you want to address?
Well, one thing that I think was also frustrating, especially for us, is the name itself. The long-term care plan is really misleading because people think this is going to be an annual benefit. They're going to be able to receive $36,500 annually, and that is not the case. It is a lifetime benefit. And so once that's run out, and depending on what you use it for, it can last, if you have to use it for a nursing home, you're probably going to see that last you 3-4 months, maybe. Yeah. If you're using some of the in-home care, that may go a little bit farther, but this is a lifetime benefit one time. But the misconception about this, and I think it was happily intended to feel this way, was that people thought this and still do think this is going to be an annual benefit. And while it does, while there are long-term care needs that some people will need help with, and I think we all can agree that there's maybe a role for something, this is not the plan for it. This is not the way to go about it. And with the actuary actually saying, hey, it's $15 billion short, it's not solvent. I think it's inevitable that there's going to be a raise on the tax. And so there's a lot that has not been communicated by certain leadership that should have been. And then the delay in the tax is also scary. It really muddied the water because a lot of people thought, oh, hey, this tax is going away, I don't need to worry about it anymore. And that's just not the case. And so the misinformation around long-term care, and though I'm glad the governor has responded and has encouraged a delay, he's not delaying it for Washington state employees because he knows it's still the law starting 5 days ago, January 1st, to be collected. And so his message to basically tell private employers, hey, don't follow the law, but we're going to follow the law, but you may be on the hook still, super confusing, and it's really frustrating to see. So I think we're in agreement. I mean, full repeal, have this discussion again. The right way is the way to do this.
Thanks, Brian. Those are great points, and I agree with you. It was really confusing December 17th to see Governor Inslee coming to our rescue with a delay that really wasn't. And you mentioned repeal, and that's a great segue to our next speaker. Senator Barno is here from Centralia. He is one of three lawmakers I know with a piece of legislation that would repeal, not just try to fix this long-term care law. I should note that Representative Barno did not vote for this misguided legislation. Not only does he rightly not like it, he wasn't in the legislature when it originally passed. Even if he had been, we'd probably still be where we are today. There was a lot of votes against this law, but almost all Democrats supported it, and Democrats were in and remain Olympia's majority party. Representative Barno has great energy for this issue, as well as a great understanding about its shortcomings. Welcome, Representative Barno. Tell us a little bit about the current legislative activity surrounding this law, even though it's hard to keep up with, and your repeal attempt.
Well, I want to thank you and the Washington Policy Center for having me and keeping this issue at the forefront. Washington House Republicans are urging repeal. There's a bill, House Bill 1594, which I drafted, and we're asking for repeal and hoping that it's repealed for a lot of reasons. And mainly the Washington Cares program has fatal flaws at every stage. You start with the regressive tax, taken out of all W-2 employees' income, which is being treated differently than many other incomes, not taking into consideration, for instance, community property nature of income for spouses, workers close to retirement, veterans, and those working in the state but living out of state. And Elizabeth, you had mentioned it earlier, for those people who invest for 30, 40 years who will like to retire to Florida or Arizona or somewhere warmer, are not going to benefit at all from all of their investment. The second stage, in addition to the regressive tax, is going to be the investment strategy, which is treasuries, which are going to grow slowly, which is not like stocks and bonds, which is going to be greatly below even the stock market growth. So you've got the regressive tax, you've got the poor investment strategy, and then lastly, which I think most people focus on, which is true, which is the benefits that are so limited that Brian was right, it should be called short-term care, because really it's limited to $100 a day for 365 days. It provides very, very short and limited care if needed. It's also not, as I said, available out of state, but one of the real issues that a lot of people have with this program, including myself, which is why I'm urging repeal, is think about how inflexible this program is. If your spouse needs long-term care, but you don't, you can't use your portion of it to supplement their care and their needs. There's so many limitations to this program. And I think Brian mentioned the solvency. The actuarial report is 55 pages long, but you only have to get to, I think, page 3 or 4, where it already says that the tax and the investment strategy under the law create a situation where this fund is just not solvent. And the more opt-outs and exemptions you create, while they, I think, address the concerns of a lot of folks in our communities, they don't fix solvency. They actually just make it worse. And ultimately, if the long-term care program, if Washington Cares is not repealed with House Bill 1594, the benefits are going to go down, and I can't imagine them going down any farther. I mean, they're pretty paltry as they are. but the tax is going to go up. And it's going to go up either on the employees, or it's going to go like family medical leave, and employers are going to be kicking in a portion of this to get the fund to be solvent. My position is, rather than force, let's encourage and incentivize planning. Let's work with the private sector and find solutions for plans that fit more budgets. Help people with pre-existing conditions, work with the private sector on this, and bring more attention to long-term care planning. I think long-term care planning is something that we all should be doing. Before 2019, I really didn't think about it myself. Being in my 40s, I don't really think about long-term care planning. This has been a wake-up call, and I think the scare is enough. But this program isn't a solution. Proposing a delay, I think it's House Bill 1732 that you had mentioned, into the year 2023, is running from the problem. It's not solving the problem. It doesn't even meet the voters part way. I mean, we know that 63% of voters opposed Washington Cares. Voters in 37 counties out of 39, 44 legislative districts voted against this plan. I think the majority needs to stop trying to pound the square peg into the round hole. Let's repeal, hit the reset button, and really talk about the needs of long-term care individuals and how we can incentivize planning and work with the private sector to get it done in a way that's actually solvent, because this isn't. And, again, this is not me saying it. It's not a partisan saying it, although it's coming out of my mouth. It's repeating what the Office of Actuary had said. The report itself finds all these flaws in the program, so delaying it doesn't help. And as much, again, as I would like to and have proposed quote unquote fixes to the program, they really don't fix solvency, they only address concerns. So we're at a point where I think there's not much the minority can do, the Republicans can do in the House or the Senate, without the help of all of you to reach out to those legislators, especially in districts who the voters have spoken loudly, and let them know your position.
Thanks, Representative Barno. Thanks for pointing those things out. Like you, I never thought about long-term care, and most people don't until they turn 50. And so it was a total new thought for me. And once I engaged in it, I see a great value in long-term care insurance, or at least having really solid plans in place and communicated to my family members about how that's going to go down. But that's the role of the state government. The role is not to tell you how you're going to save and dictate how you're going to save and compete with the private sector in this way. So your solutions are right on target. More people having this discussion is the silver lining of this whole mess, is that now people are thinking about it. They are saying, how am I going to afford this? They're looking at the cost of care survey by Genworth or other research arms places that show it's going to cost $10,000 in Washington to be in a nursing home, or it's going to cost $5,000 for at-home care. So these are things we need to know, and it's a valuable discussion. But again, like you say, a regressive tax that requires low-income people to be paying for people not in need in some cases is not the right way to go about this. And given all the fixes that I've seen filed, if they keep fixing the unfair eligibility for different groups, for instance, people who live in Idaho or H-2A workers, etc., either the tax is going to have to go up, or the benefit is going to decrease. And then you've made this more worthless than it already was to begin with.
Well, and I think it's gonna come back in the end if the program stays, because I think Brian alluded to it. It creates an illusion that your long-term care needs are being met or will be met. And it's an illusion, because we know even from the AARP website, where you look at the cost of long-term care, whether it be in a facility or at home, this benefit, this one-time benefit, uh, really at most is going to be, as Brian mentioned, maybe 3 or 4 months, maybe 6 months at the most. And then what do you do? If you were to invest that same amount of money, if you're a couple earning $100,000 between you, and you invest that $590 for 20 years, just in the stock market that grows at a rate of 8 to 10% adjusted, right? You're going to have more benefit for retirement. You're going to have more flexibility. So why are we not working with the private sector to find better ways, better investment strategies, and better opportunities for people to invest in long-term care? I mean, that should be the goal of government, not necessarily to take it away, but to create opportunities for people to find pathways for long-term care planning.
Exactly right. I mean, the false security angle of this is the most frustrating. And as I continue to see this public relations campaign roll out, it's been frustrating at every turn to say, we're all taken care of. This helps us all. This is going to fix it. It hasn't fixed it. There's a reason it's a one-of-a-kind program, the only one in the nation, because it's no good. Representative Barno or Brian, do you either of you have any just comments to make about the Medicaid silver tsunami scare? I mean, it's a real thing. The budget is growing. Are there fixes you see that could help that situation from overwhelming the state?
Well, I think I don't know if I necessarily see the immediate budget solutions, but I do see programmatic solutions. And again, I mean, even if you wanted to talk about long-term care planning and how we can prepare for that, there are ways that we can inform the public about how they can handle long-term care planning, their retirement, how you deal with those types of situations if you need in-home care or whatnot. I mean, I'm an attorney. I mean, many attorneys have done estate planning and long-term care planning. I mean, there are ways to deal with these types of issues that will provide you so much greater benefit and flexibility than this program. So, yeah, I mean, I just don't know whether or not, my nature is to always come with, is there a legislative solution to it? I guess there is, but there's better ways to provide opportunity in the private sector and just encouraging people and informing them on how to do that. Incentivizing is much better than punishing, and this program punishes.
And I think the legislative solution is repeal in this case. And so we're excited to see repeal legislation being talked about. And we hope, what do you think the chances are for a hearing?
I don't. I mean, unfortunately, the nature of this legislature, I mean, the governor has spoken at numerous press conferences talking about how he's reached out to legislators and he's working on it. Representative Schmick, who's the ranking on healthcare and wellness, as far as I understand in my discussions with him, he hasn't been contacted. I haven't been contacted. So, it's whether you're talking about long-term care or any other issue, it seems like the echo chamber is too big. And so I don't think those in the majority or the governor are speaking to the right people to find good balance to really look at a resolution. I said it earlier, I think delaying this program into 2023 is running from the problem, not finding a solution.
Yeah, it's only putting it off. We're going to be right back here, and it's going to be less solvent at that point.
Yep.
Continue to pull people out of the pool. Right now, I think there's 462,000 people who have opted out as of December 29th. That's out of about nearing 4 million workers. So it's about 11.5%. I've done loose math and probably shouldn't. And those are worst case scenarios that Milliman had discussed. But when you're already in the hole and you're already not solvent, right, we can see where this is headed. It's an increase to the tax or a decrease to the benefit. I'm sure of it. I'm sure we have some questions, and I'd like to go to those. Dave, can you help me?
Absolutely. First question, what's the average time in long-term care for those who end up needing it? And the follow-up is, what is the average cost per month of long-term care? And the questioner points out that their view is the semi-private nursing care costs $10,624 a month in the Seattle metro area. So I think there's a bit of a rhetorical question to this, but I think they want to illustrate a point. Go ahead.
Yeah, it's a good point. And interrupt me if you guys have different data. I haven't looked at the data today or the research, but I believed that it was about 2.5 years that formal long-term care was needed by people. I don't know though. I have a grandma who just passed away, and she entered long-term care around 70 and she lived till 99. I mean, there's a lot of years that make this average, but I believe it's 2.5. Do either of you recall, Brian or Peter?
I mean, Brian might have a different answer. I mean, obviously, long-term care is a pretty broad subject matter. It depends on if you're talking about in-home care, partial, if you're talking about a private bed, a double. I mean, I've seen reports on, $50 an hour for some in-home health aides. So, I mean, depending on how often you'd use them, but if you're talking about going into a facility, you're anywhere, maybe Lewis County, it'll be less than in King County. But when I was looking at some of the figures from AARP and others yesterday in preparation for this, it was anywhere between about $4,000 and $10,000 a month.
I'm looking at genworth.com right now, and the cost in 2022 for a private room is estimated in Washington at $9,358. The cost for community assisted living is $4,562. And the home care cost, it says for 2022 is going to be $4,855. So those are some of the numbers, so if you've got 3 to 8 months of help, and then the things you choose have to qualify for this long-term care fund. That's something we don't even know about at all yet. How is the administration of this thing gonna bang out? If I apply for one thing you brought up, Representative Barna, was it was $100 a day, and I heard they changed that. I'm not positive about that though, so I'll have to check up on that. But even if they changed it, that just minimizes the number of months or weeks that you have the care. If you're able to contribute more than $100 units to one day's care needs and cost. So
the other thing that's not really being discussed very much is, the spouse. I mean, when I'm paying for long-term care out of a payroll tax, technically that's community property. That's a community asset that my wife has a community share of. If I don't need long-term care, but she does, I can't transfer my portion of that to my wife, whether she works or not. So it really is, it's so flawed at so many different levels, and doesn't recognize the real needs of families in terms of long-term care planning.
great point.
Well, and I'll just mention one of the other things that's so concerning is the government competing with private industry. And you saw almost a full collapse of the long-term care market from March until November 1st, because they couldn't handle the amount of people that were getting on it. You had some insurance brokers we talked to said, hey, we averaged like 10 people a month that would call us about long-term care. And all of a sudden they were getting over 1,000 phone calls, and it was overwhelming. And you saw people pulling out of the market like crazy. And the government should not be in the business of picking winners and losers and competing with the private market. Now there's a role for government to help make sure the market is fair. And, like Representative Barno says, maybe figure out a way to offer some better programs that can address these needs. But there is a way to do that through the private sector. And that's, the government should be there to help drive some of those conversations possibly, but not compete or essentially destroy an entire industry.
The industry piece is a big one. I spoke with a lot of sources all along the way this spring and summer, and they are being put in the position where they're scared to death that all these people are going to leave their plans the second they can. And I encourage no one to do that, because I think a recurring attestation will be required in the future. And that if you leave your plans, you might be in trouble if you got the opt-out. But that's something they're facing. This industry was totally disrupted. Sellers had to stop taking anyone who was, I think, younger than, do you remember the age? It was, if you were younger than a certain age, you no longer could.
If you were under 40, a lot of people couldn't get a plan, and if you were over 70, you couldn't get a plan either. So
yeah,
it became a huge problem.
David, do you have another one?
Yeah. Next question. Does the program have annual healthcare cost of living adjustments for benefits?
Go ahead and take that, Representative Abarno. I know it's tied to inflation.
Yeah, I mean, it's tied to inflation. I don't know necessarily whether there's cost of living other than that. The hard part about it is, we look at a year like this year, where you're looking at all the other costs involved. That doesn't necessarily track. It's usually after the fact. It doesn't actually happen with. So I think that's going to be the problem with this plan as well. I don't know how much that's going to change the fact that it's still a very small limited benefit, because it's just going to track the costs as well. So as medical costs go up, I think they're going to probably outpace any cost of inflation or growth in the actual value of the tax.
Next question. Any concerns that the bill titles on the delay bills will scope out any amendments for a full repeal?
Yes, I've had that discussion. I do think that that's going to be an issue, that the language of the titles are drafted very narrowly for reason.
Explain that a little more. So you see delay being misrepresentative because of the?
Well, the title of the bill, any amendment has to relate to the title of the bill. So if, for instance, and obviously I haven't caucused on this specific issue, and I don't know what a ruling from the speaker would be. But if a title says delay and you offer amendment to, repeal, they'll say it's out of scope and it's not an appropriate amendment. Now, that doesn't prevent someone from proposing indefinite delay or something of that nature. I mean, but again, that's a lot of inside baseball that, I think the House Counsel and Senate Counsel are going to have to deal with as this goes through the process and if it gets to the floor in committee.
Thanks.
Next question. Even the representative said he was in his 40s and hadn't been thinking about long-term care. Many people don't think about long-term care until it's too late. How is this bill worse than doing nothing?
I think this bill is worse than doing nothing, because not everyone chooses long-term care insurance or a long-term care program that a state makes to handle long-term care. We make investments, we have real estate, we have plans with our families. I would rather see people retain their choices in regard to how they finance long-term care. And all of us might not need long-term care. 7 out of 10 of us are estimated to, but that leaves 3 of every 10 who don't. And so it's certainly not better for those individuals.
And I don't think that the suggestion is even from me to do nothing. I most certainly think there's ways that we can incentivize investing in long-term care. I think there's a lot we can do on education. There's a lot we can work with the private sector on trying to scope some of these plans to find things that fit within budgets. But the other thing is you're going to have, like, my son is 9 years old. So in 9 years, he's going to start paying into this for the next, hopefully 40, 50 years of his working life. He's going to invest a lot more in this plan than he's ever going to get out. If I tell him, take that $280 and invest it in the stock market, that you can use for long-term care if you ever need it or something else, he's going to have a lot more money and more flexible. We should be encouraging different sort of flexible investments and there's ways to do it. So I don't think anyone suggests that we repeal and then just walk away. I think this is a good conversation to have. It's an important issue. But this plan actually, again, even the part of creating the illusion that long-term care is going to be dealt with, I think is actually kind of dangerous.
Yeah, no, I think that's exactly the right point. The government has a good role here. It's brought up the conversation. It can have the conversation, and we should. It's going to be a problem.
Yeah.
Squeezing in one last question, could it be that the state bureaucrats and politicians don't really care about the solvency issue, that they're seeking the crisis for an income tax?
Well, I mean, I think there's an argument to be made that this is a quasi-income tax because you're treating W-2 employees different than contractors. If for any business out there, if you're a partnership and you file as an S corp versus a partnership return, you may or may not have to actually pay this. So it actually treats the same income from the same source differently. So I think there is a income tax constitutional question to be had on it. But I keep hearing that this is a social program. So I think many people who voted in favor of this don't see this as an insurance, which insurance companies would want solvency. They see it as a social program that will be backfilled with other budgets long-term, or an increase in taxes, which the Office of Actuary says is going to be needed.
Exactly. That's what I hear too. When I've sat through commission meetings, it's been made clear that this is a social program. You don't always get an unemployment compensation because you're not unemployed. This is created just like this. It's for everyone to use if they need it, when they need it. It's not an insurance program, which is very confusing because on the public relations campaign the state is putting out about the Washington Cares Fund, all over it, they're calling it a premium that you pay for this insurance program. And then they go to these meetings and say it's not insurance, it's social. So it's confusing.
Well, we want to thank each of you for participating in today's Solution Summit, Day 2 of Solution Summit. Mr. Ricker, Representative Barno, Elizabeth, thanks so much for your insights and your information regarding this long-term care tax and long-term care program, so-called. And if you want to learn more about our healthcare work or worker rights endeavors here at Washington Policy Center, go to washingtonpolicy.org. And you can see that also for things that were referenced during the Solution Summit so far. You can go to our resources page. It's featured right there on the homepage and will be for another 24 hours or so, so that you can see all the documents listed right there for your convenience. The Solution Summit will continue here after a short 5-minute break with our final session, how to target millennials and Gen Zs in a language they understand and appreciate. Thanks for joining us here on the Solutions Summit. We'll be right back.